Hello, everyone, and welcome to our third seminar of the Surveillance Advances series, 2024 to 2025 season entitled Wastewater Monitoring in Northern and Remote Areas, the Eeyou Istchee Experience. This seminar series is co-hosted by the Public Health Agency of Canada and the National Collaborating Centre for Infectious Diseases, or NCCID. My name is Robert Sager, and I'm research staff at the NCCID. I will be your moderator today, along with Chia-Yu Lin, who is a senior policy analyst in the Data, Surveillance, and Foresight branch of the Public Health Agency of Canada. The NCCID is funded by the Public Health Agency of Canada to provide knowledge and evidence for use in public health planning, programs, and policies related to infectious diseases. We are incredibly pleased to be co-hosting the series with the agency. So first, I would like to begin by acknowledging that the NCCID is hosted by the University of Manitoba. The university is situated on Treaty 1 territory, the original lands of the Anishinaabe, Cree, Cree, Dakota, and Dene peoples, and homeland of the Métis Nation. As an organization, the NCCID recognizes the systemic inequities in treaties that have been implemented as part of the process of colonization, intended to benefit some while harming others. We are committed to working with our partners towards reconciliation, and we strive to honor the lands and their original caretakers in our work. I am joining you today from the city of Hamilton, situated upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississauga peoples. This land is covered by the Dish with One Spoon Wampum Belt Covenant, an agreement between the Haudenosaunee and the Anishinaabe to share and care for the resources around the Great Lakes. Before we dive into today's seminar, there are just a couple housekeeping items I would like to mention. So first off, a recording of the seminar and the presentation slides will be available shortly after the seminar on the NCCID website, nccid.ca under webcasts. Second, the chat box for participants has been disabled for this session. The hosts will use the chat box to communicate additional information with participants. And if you have technical problems with Zoom during the seminar, please email us at nccid@umanitoba.ca. Finally, please send us topic-related questions through the Q&A tab, and we will try to address as many as possible in the discussion period after the presentation. You can like any of the questions to push them up in priority. Also, we would like to note that the Surveillance Advances is a Section 1 self-approved group learning activity as defined by the Maintenance of Certification Program of the Royal College of Physicians and Surgeons of Canada. The seminar series is also approved by the Council of Professional Experience for professional development hours for members of the Canadian Institute of Public Health Inspectors. If you require a letter of participation, please look out for the survey that will be shared after the seminar.
Thank you, Robert, for going over the housekeeping items. Welcome, and thank you for joining us today. My name is Chia-Yu Lin, and I'm a senior policy analyst from the Data, Surveillance, and Foresight branch at the Public Health Agency of Canada. While today's seminar will be delivered in English, we welcome everyone to post their question in their preferred choice of the official languages. Please feel free to ask your questions in English or French. I would like to take this time to acknowledge that I'm joining you today from Dundas, Ontario, the land where I live and work, situated upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississauga peoples. This land is covered under the Between the Lakes Treaty No. 3 and protected by the Dish with One Spoon Wampum Agreement. Today, Dundas and the city of Hamilton are home to many Indigenous peoples found across the Turtle Island. We honor the Indigenous peoples who have lived on and cared for these lands for generations. As a first-generation immigrant from Taiwan, I'm grateful for the opportunity to share and call this place home. Today, we have participants and presenters joining us from coast to coast to coast. The land in which they and you join us from represent the lived experiences of many Indigenous peoples, all with their own unique health story. We would also like to acknowledge that practice of public health surveillance may raise concerns for Indigenous peoples and other communities. To public health professionals, Surveillance sounds similar to epidemiology, which is about understanding the distribution and patterns of the determinants of health and disease in population. But for others, surveillance may carry negative connotation about security, privacy, and control. For this seminar series, we would like to know that we use the word surveillance to refer to the assessment of and response to public health threats as a core function of our public health systems. This seminar series is not just about the speakers and organizer. It is about you, the audience. Your active participation, questions, and perspectives are vital to the success of this initiative. We encourage you to engage in discussions, ask questions, share your thoughts, and foster collaboration that can lead to improvements in public health surveillance. Thank you.
With excitement, I would like to introduce and welcome our speakers. Today's seminar will be presented by Dr. Catherine Dickson and Reggie Tomatuk from the Cree Board of Health and Social Services of James Bay and Laurence Truong from the Cree Nation government. Dr. Catherine Dickson is a medical doctor with a specialty in public health and preventive medicine. Catherine works as a medical advisor with the Regional Environmental Health Team at the Cree Board of Health and Social Services of James Bay. Reggie Tomatuk is a Programming and Research Officer, PPRO, at the Cree Board of Health and Social Services of James Bay. Since joining the team in 2001, Reggie has played a pivotal role in enhancing regional environmental health. His collaborative spirit shines through in his partnerships with various organizations and First Nation councils, including Manuhiku Mental Health, the local Men's Association, and the Residential School Committee, all aimed at promoting community well-being. With a degree in water engineering from Laval University, Laurence Truong is an accomplished engineer with a passion for environmental protection and quality of life in northern communities. Since 2020, she's been working for the Cree Nation government as a water quality engineer, leading her team to ensure sustainable and safe access to drinking water in the Eeyou Istchee Cree communities. Her mission includes coordinating with the federal provincial governments, developing a training program to support and develop Cree human resources, and implementing strategies adapted to Indigenous traditions. So welcome, Dr. Catherine Dickson, Reggie Tomatuk, and Laurence Truong. We are very happy to have you join us today, and we are excited to learn about your experience and knowledge in wastewater surveillance in Cree communities in Eeyou Istchee. The floor is yours.
Thank you, Robert. Thank you, Chia-Yu, for this amazing introduction. So good afternoon, everyone. Like mentioned prior to this, my name is Laurence. I'm the Water Quality Coordinator for the Cree Nation government. And with my colleagues today, Catherine and Reggie, we're happy to introduce our presentation, which is Wastewater Monitoring in Eeyou Istchee. So just before we go on with our presentation, we would like to share a little anecdote on the title of our presentation. Could you press on the next slide? Thank you. So when we did this presentation, first of all, through Indigenous communities and Cree communities, people were really confused with the word wastewater. So at some point, we had to change the word wastewater for mayabu, which is the traditional Cree word for sewage, because people were confused with wastewater. They heard water, they were focusing on the word water within wastewater, and they thought actually that we were monitoring drinking water for some specific diseases. It created a big chaos. But that's a small introduction just to let you know that wording and language barriers and understanding your public is really important when it comes to information transmission. So next slide, please. Conflict of interest. We have no conflict of interest to declare. And by the way, like Robert and Chia-Yu mentioned, this presentation will mainly be in English, but if you guys have questions en français, très bilingue ici, donc pas de problème. Si vous avez des questions, n'hésitez pas à communiquer même directement en français. On va être capable de répondre à vos questions là. Catherine, Reggie, and I are from Quebec, so we have both languages under our belt. Next slide, please. So our learning objectives today. First one is the importance of building and maintaining community partnerships in water surveillance work. The second learning objective that we have today is the importance of communicating information in a way that your intended audience understands, which brings us to the little anecdote I just told you about for the name of the presentation. Second slide, other slide, please. So here's the outline of our presentation. We'll switch back and forth between Catherine and Reggie and I through this presentation. We'll go over our wastewater system setup, the community-driven surveillance program, outreach and partnership we've built through this project, the challenges and limitations of our monitoring program, and obviously future applications of wastewater surveillance in Eeyou Istchee. So I would like now to invite Reggie to continue this presentation. Next slide, please.
Hello, Wajak. As you can see, the red dots, that is covering communities that we cover, and there are about 20,000 Crees, and the largest community we have just above northern James Bay is roughly about 6,000 people, and that is where we are situated. The community is called Chisasibi, and this is a community-driven project, and it was requested by the chiefs once they knew that we were capable of providing this type of service. And we are supported by the National Microbiology Laboratory in Winnipeg. Next slide.
Waja, I'll take over from here. So in terms of the reason that we were looking and that we had interest from our chiefs in bringing in wastewater surveillance in communities like ours that are not located near to large centers is that, first of all, we need information in order to guide decisions like we do everywhere. However, unlike other parts of the country, particularly as COVID advanced and testing capacity increased, our communities have one hospital in the largest community and one clinic in the second largest community that has laboratory capacity. And they both had quite small laboratory capacity. So being able to test everyone who was symptomatic to have a picture of what was going on in the communities was quite limited and often took time, because for many of our communities, we needed to send samples to an external laboratory by plane. They might get there, if there's a flight that day, they might get there the next day. They might take a few more days, especially if the weather's bad. And we were also starting to see testing fatigue, which, I mean, I think we can all appreciate at this point. And the appeal of getting a nasal swabs just doesn't get any better. And also with rapid tests being more readily available as the pandemic progressed, it also meant that even if people were getting tested, this information wasn't getting reported. So we didn't have a great idea from human cases to be able to monitor what was going on in real time necessarily. And particularly for our communities that, because of their remoteness, we were able to maintain COVID-0 for quite a long time during the pandemic. Being able to identify the presence of COVID-19 in the communities was also extremely valuable. Next slide. Oh, back one, please. Great. However, we need to keep in mind that it can be challenging to set up with wastewater surveillance in remote locations like ours, that generally, and you may have gotten to see some examples of some of the large cities wastewater testing, we usually require a large laboratory with multiple instruments and specifically trained individuals, which would be very hard to have on site in communities like ours. And as we had challenges with shipping delays with our nasal swabs to get test results, it would also cause delays in shipping out wastewater samples to larger laboratories in the south. And particularly if we're looking to use wastewater samples as an early warning system, the longer it takes to get the results, the less useful it is as an early warning. The gene expert system of PCR was proposed as a potential alternative to conventional labs for wastewater testing in remote locations. And this was something that we were able to work with the NML to be able to have set up in our region. Next slide, and I'll pass it back to Laurence.
Thank you. Thank you, Catherine. So now I'm just going to touch base a little bit on how we did the protocol for sampling the wastewater. So in communities, in the Cree communities, we're lucky enough that all the houses and all the buildings are connected to a sewer system, so a regular collection sewer system. So one thing that we did is that for all the communities that would participate to the program, we bought them this auto sampler machine that you see right there on the screen above the little fridge. So we were able to purchase those machines, which would allow us to do a composite sample, which means that we would be able to take over a 24-hour period, a few milliliters of water at different time during 24 hours. So we could get a sample that would be representative of the community's population. So behind this, before putting this program all together, we did a lot of planning, we did a lot of trainings with water operators, we did a lot of installation. A lot of work was put behind, or at least was needed to be done in order to have this program set. So this was one of the things we had to do, is to purchase those machines, train those water operators, talk about health and safety risks, because at that time people were really afraid of COVID. And I mean, wastewater in general is not super sexy or glamorous. So already there, people were not too happy about working with wastewater. So that was also a mission that we had to do as a group, was to provide guidance, but also reassurance when it came to the protocol, the wastewater sampling protocol. So basically, like I said, those systems were installed in the main sewer main lift stations that are located at different places around the community. So we were able to get the main lift stations where all the wastewater and all the sewage water would come before reaching the lagoons. So this is where we installed all those machines. So that's to give you a little brief overview of our setup. Next slide, please. And then when it came to shipping, like it was mentioned, we had to collect water sample over a 24-hour period. Then we would use Air Quebec, which is our air company, I want to say, our charter flights from the Cree Health Board. We were able to send back and forth water bottles and samples to our local laboratory based in Chia-Yu. So you see that is highlighted in this map in blue. So Chia-Yu is where Reggie is located, actually, and he has set up a lab there where we do the wastewater testing. And in green, you see the community of Wastewater, which is one of the community that is still doing the program today. So we have two communities doing following up with the program, or at least still doing the water testing. It's Chia-Yu and Wastewater. So like we mentioned, all our samples are being shipped by plane, and this is the current situation. So in the map, you could really see where our communities are located. And at our peak point of the program, we had Chia-Yu, Wastewater, Mistissini, that, and even Waskaganish that was doing the program. Yeah, so back to you, Reggie, I think. Next slide.
This is our team. We have 3 local lab technicians, and they're directly coming from the Chia-Yu Research CIRI, they're called, and it's a research
Chia-Yu
institute.
Resource and Research
Yeah,
Institute.
my phone just started talking to me. Sorry.
Sorry, I can't help find your devices right now. You can check the location of all of your items.
I don't know. Sorry. Our team consists of 3 Cree lab techs, and we do the sampling at a lab located near Chisaswi. Well, not near, but just maybe a less. It's in the community, we could say, and the gene expert provided by NML, and we do tests done of 4 different viruses, and it was important that we do these samples because of what Catherine had said. A lot of people were no longer wanting to get tested, so this was the best way that we were able to test for COVID and other viruses that can harm other people. And once we get uh, our samples at the lab, we were able to get it within 2 hours. And yeah, it's good that we have our Cree. I think our youngest one is maybe 20 years old. I think he is, and I'm glad that we have our young Crees doing this. And it's really important that we get proper training, especially for something as important as these tests are done. Next slide.
So once Reggie and our great laboratory team do the run the PCR test and send the results to us, we have multiple routes by which we do reporting of the wastewater results. So there's an internal COVID report, which I believe has now been renamed as our respiratory infection report, that at one point was being done daily, and we were reporting on the wastewater weekly with that. And then we're currently releasing the results monthly, where we provide an update on what's going on in the whole region, including those 2 communities that we're currently using as a sentinel surveillance system, as they represent both the coastal area of the region as well as the inland area of the region. And we also provide each of the communities with biweekly emails that get sent to staff at the municipal level that was identified by the community as their point person, as well as people designated at the local clinic, because that's important for them to know what's currently circulating. And the reports contain trend graphs to look at how concentrations have changed over time, which is representative of disease rates in the community, as well as an indication of the presence or absence of COVID, flu A, flu B, and RSV, which are the 4 viruses that Reggie mentioned. A little bit of an interpretation that, this is detectable, which wasn't detectable before. Trends seem to be going up or going down. And we also use this as an opportunity to provide reminders about staying home when you're sick, getting vaccinated for COVID and flu, as well as RSV, and reminders about hand washing and that sort of thing as well. Next slide, please.
Our means of communication is through radio and also through social media. And it is in our region, it's such a large, vast area. And how we're able to communicate with our community members is through radio or being on, not always being on Facebook, but that's how we communicate with our regarding the wastewater testing, informing our communities to be cautious in case of there is a high percentage of COVID found in the wastewater. And we do have other means of communications. These radio CBs. They're called CB radios, and they're quite small, and they're able to cover at least 100 to 200 kilometers radius of the community, and that is how people communicate together. Next slide. Training is quite important with the wastewater workers, and gladly having the Cree Nation government support as their consultants within the First Nation councils in Eeyou Istchee. I'm grateful to say that Laurence has been instrumental in training our wastewater operators within the whole region, and these are the we have a lot of sand, but I was just gonna say that I was wearing a mask because I think there was some COVID going around, and that's Catherine there, and I think we were being taught how to collect the wastewater samples. Next.
So one of the questions that we frequently get from training that Laurence already sort of alluded to is questions about worker safety. And particularly when we were at a state of COVID zero and we weren't seeing COVID being circulated, there was a lot of anxiety among both the wastewater workers as well as our laboratory workers about the risk that they're putting themselves at by taking the sample and working with the samples and whether they could contract COVID from it. So one of the explanations that we liked to give was the fact that with the PCR, we're looking for dead pieces of viral DNA in sewage that COVID does not tend to survive very well in wastewater. So it's like finding a bear's footprints and not the actual bear. But we did also use this as an opportunity to provide some reminders about general workplace health and safety for anyone who's handling wastewater, because there are other infection risks that certainly come with that. So it's a good time to have a reminder about making sure that your vaccines for other infections, as well as COVID, not due to their work, but due to the fact that this is the time that we're living in, are up to date, as well as reminders to wear appropriate protective equipment while handling the samples. Next slide. So this was another activity that we were involved in, which actually resulted from another story that Laurence had already alluded to about the first time that we'd put out a public announcement when we detected COVID in the local wastewater. And we'd put out an alert that there's COVID in the wastewater, so there's probably some COVID in the community. Please take cautions and consider reducing numbers of public gatherings. And this led to a mass panic because people heard that there was COVID in the water and were worried about whether they could brush their teeth or shower, or if that was going to be a risk. And we used this as an opportunity to do some additional outreach. So there were Facebook posts clarifying, there were there was a long radio talk show, as well as we had the opportunity to go into the high school and talk about our project, as well as to help provide some clarification about the difference between wastewater and water, which ultimately led to, from the suggestion of some of the wastewater workers we were working with, to don't use anything with the term water in it. It's going to cause confusion. Use sewage or use meabu. So that's changed a lot of how we worked with it. What I also wanted to point out is the photo on the right-hand side has two of our laboratory techs, Jesse James and Nicholas, who went to that high school. So it was a really great opportunity to be able to highlight STEM opportunities for graduates of the Chia-Yu Lin High School. And we got some requests to go visit the lab afterwards as well. There was some good interest from there. Next slide. So wastewater surveillance and setting up the system, definitely, although we had some great successes and feel great about where we've gotten with this, it didn't come without challenges. So one of the concerns that we've certainly heard about was from members of the public about privacy concerns and how looking at how we can provide reassurance and also ensure that we're protecting people's privacy. And this required quite a bit of reassurance that we're detecting whether there's COVID in the community as a whole. We're not able to identify which address COVID or any other infection or any other substance that we're measuring for comes from. We'd explored the possibility of doing some passive sampling where we'd be able to collect samples higher, more upstream in the community to be able to look at specific neighborhoods or specific buildings. And that was an area that we decided that maybe this wasn't the time, there wasn't the appetite to go there, and just having this information about overall trends was particularly helpful, or was helpful enough, and that it might get more sensitive because you're working with such small populations anyways. The pictures of the packages with the labels shows some issues that we had with shipping, that because we're using our health board shipping processes and we're introducing a new location that things were not usually getting shipped to, somehow the labels for the hospital laboratory kept getting put onto our packages. And our lovely friends at the hospital laboratory were getting sewage samples sent to them, which did not make us particularly popular with them. Reggie helped to resolve this by getting a new set of labels printed out particularly for us, which helped to make sure that we weren't chasing down our samples and our colleagues weren't getting unpleasant surprises in the mail. And then the bottom photo of Reggie with these three lovely ladies was during the surge of cases that we had around Omicron. We actually ended up having to stop our wastewater monitoring because we lent our gene expert to the hospital laboratory in order for them to be able to increase their testing capacity. We hit a point where we had about a 7-day delay in getting test results just because there was such limitation in number of samples that they could run at once, and the demand for samples. And if we were asking people to isolate while waiting for their results, which was really not a very easy thing to do, to ask people to isolate for an extra week while waiting for their COVID results, and was limiting the ability to have frontline workers being able to provide essential services. Next slide. And a question that we often get is around what's next. That certainly with the change from the wastewater monitoring during the COVID pandemic, where we were collecting samples multiple times a week, we're down to the point that because of the demand for our wastewater workers, we're getting one sample a week from each of the two communities that are still acting as sentinel surveillance sites. We've expanded to be able to run tests simultaneously for 4 respiratory viruses and are exploring other potential uses for it. We've had some initial conversations with the involved communities about the possibility of doing some drug surveillance and looking at illicit substances that are in the wastewater in order to help better inform programming for people who use drugs in our communities. That's been it's been a very slow discussion that we're having, but something that we'll be continuing to explore, and have also been promoting this as a program that by continuing to do the weekly sampling and the fact that we now have auto samplers set up in 8 of our 9 communities, if there is a need to quickly set up a new surveillance system or expand our existing surveillance system because of a new threat, we now have more capacity to be able to do so. Next slide. And as a final word, we'd like to thank all of our partners who've been extremely instrumental in helping us with this ongoing surveillance system, and for the particularly the 4 communities who were either temporarily involved or continue to be involved. We would not be able to do this without everybody in this list. So, Aguda Miigwech, thank you so much.
Well, thank you so much, Catherine, Reggie, and Laurence, for sharing your Eeyou Istchee experience in wastewater monitoring. We will now start our discussion period. We invite everyone to ask any question you have for our speakers in the Q&A tab. You can also upvote other people's questions. Everyone is welcome to participate in this conversation. You're invited to ask questions in your choice of the official languages. We will try to address as many questions as possible, but we may not be able to get to all of them. Oh, wow. We have first question up in the Q&A tab. During COVID-19, much focus was spent at the borders of Canada, and information was shared down to the province's territories and onward to local public health authorities. But there was not as much information coming the other way, up through the levels. In your view, how best can wastewater testing information like this be used by the Public Health Agency of Canada to determine its border posture in protecting public health? And then there's a information provided about the border posture is the set of measures that are employed at the borders to prevent the spread of communicable disease.
That's a very good question, and we need to keep in mind that we are quite far away from any national borders, and our location in Eeyou Istchee. But I think that it provides information on what's present and could certainly what's already present, and also will help to understand what's not present in any particular area. So I guess you could think of somewhat that because we had checkpoints for people coming in and out of the communities and people entering our communities in our region were asked to isolate. And this did provide us with some almost like a border being set up there. So being able to monitor when we didn't see COVID in our region, and knowing that it provided information on when new cases came in, it was probably, or when COVID was identifiable in wastewater, it did give us some sense of this was something new that we were able to follow up with people who had recently come into the community. But again, we're definitely not border protection experts in this. I don't know if anyone else in my group wants to add anything else.
I would just add that it was really important that we have the proper data so that our leaders can understand and provide more information to the public. And it was really important that we inform our leadership better and faster, especially the way that we did these type of studies.
Thank you. Okay, move on to the second question. This question is from Jordan. He's curious to hear what your thoughts are on how the data that you collected was used, as well as for future use case. Regarding to the trend line data, did you find that the change in RNA abundance was meaningful or too variable to be meaningful? Did you compare SARS-CoV-2 RNA abundance result to other jurisdictions?
Good question. So we had a very basic system that we don't necessarily do much in the way of corrections or adjustments with our measures as you'd see with larger laboratories, which means that as people come and go from the communities, you do see some changes in your concentrations just because Christmas holidays, when maybe you have more people visiting, or what we have called Goose Break, which is the big hunting holiday when most people leave the communities to go out hunting. We do see quite a bit of variation there. So, and we also do see variation in concentration between our communities, which is probably due to community size, as well as probably the way the collection systems and even other things that get moved into the wastewater. If you have laundry facilities at the hospital or whatnot, you're going to see quite a bit of variation there. So I think there was quite a bit of variability. I mean, we did see time trends that did seem to correspond with when we were also seeing more cases, back when we were getting more in the way of case report data. So suggestions that did provide, the concentrations did provide some information, but there was a lot of variability, and I wouldn't feel comfortable comparing concentrations between communities or between our communities and other jurisdictions. And again, I don't know if others want to add.
I would just want to say that it would have been really important that all 9 Cree communities participate in this data-driven decision-making collection, but it was unfortunate that hopefully in the future we will have 9 Cree communities join in.
Thank you for providing the answer. It's always important to have something started, and then hopefully the effect will expand. We have another questions. Jennifer is wondering how agile this technology is to adapt to new substance ID and remain technologically relevant.
That's a very good question, and why we rely on our close relationship with the NML to be able to hopefully get access and have people who are much more laboratory adept than we are to change and adjust testing to be able to remain relevant as new infections, new strains, new substances come into play. And that can be a limitation with a gene expert, that we really rely on the fact that there are cartridges developed and available commercially to be able to, commercially or through the NML, to be able to identify materials. And certainly as new things develop, we probably need to be reliant on laboratories, which would be on other larger laboratories, which would be the plan for substances, that we wouldn't be testing for those in our lab. But if we did go in that direction, we would be sending out samples once a month to the NML, who would send it to the laboratory, the Health Canada laboratory that they're working with on this, and we're able to detect the basic concentrations, but aren't able to get information about strains until we send it to our laboratory colleagues. So there's some capacity on territory, but a lot of the agility is going to depend on the bigger picture.
Thank you, Catherine. The next question is wondering, is there any interest to expand the program for detection TB in the community?
That is an interesting question. Not necessarily for our region. We're fortunate that we don't have as high TB rates as some other parts of the country are currently dealing with. And so that hasn't been something that we've been actively pursuing. I know our colleagues in Nunavik have been exploring this. So the gene expert is used in remote locations to be able to detect TB in human cases from sputum samples. And it's still being explored as to how much TB is shed in stool or urine. There is the thought that probably as you're coughing stuff up, you swallow some of it and it will get excreted. But that's still being explored, but certainly something to stay tuned, that we may be seeing colleagues in other remote parts of the country adopting this or exploring it in the future.
Thank you, Catherine. So close to the end of your presentation, you did mention briefly about monitoring drugs in the sewage. The next question is wondering, is this also something that you would like to do completely within the community? That is, with testing also done locally or nearby?
No, drug testing is way too complex, and because there's interest with federal partners in doing drug testing, and they have the laboratories with much more capacity to be able to switch directions as new drugs become identified and on the market. And there are a lot of legal implications with testing for illicit drugs. So this would be something that we would be looking to ship out the samples to be done at a certified laboratory that is approved to test for illicit drugs. It does mean that we wouldn't be able to get the results as quickly. So this information wouldn't be useful for acute responses, like identifying that there's a bad batch of something in the community. But what it would be helpful for is to understand how trends change over time, and what the drugs that we tend to see circulating in the communities are, so that you can target programming towards substances that are actually being used, rather than what we might be hypothesizing are used.
Thank you, Catherine. I'm going to pause a little bit to see if Reggie and Laurence would like to add anything. If not, I'm going to move on to the next question. So the next question is whether RSV result led to informed public health interventions such as vaccination, particularly in children, given its mobility and mortality impact on this group.
Very good question. So the one year that we detected quite a bit of RSV was it would have been back in 2021, which I believe was right before the RSV vaccine really got on the market and was available. So we were able to use this to inform clinics, so that they were able to be aware that it was there, and also provided some options to change their approach to a small child, to young children who were presenting with severe respiratory symptoms. However, I think this would possibly be an opportunity to promote RSV vaccination in the future if we were starting to see more high RSV presence in the wastewater. So great question. I think we'll see how it rolls out. We've been warned by the NML that the test kits aren't as great at detecting RSV with the gene expert as they are for flu A, flu B, and COVID.
Thank you, Catherine. So we have a follow-up question from Jordan. He's wondering what do you feel are the next steps in developing this work? Do you think it is more important to expand the monitoring target compound disease or to work to focus on advancing testing methods?
That is a very good question. And certainly from our standpoint, and keeping in mind, Jordan and others, that we're very much on the ground, is that, and doing some very, very basic laboratory methods. So for us, I'd think that having more targets available would probably be more valuable for us. However, that doesn't necessarily tell the whole picture of wastewater surveillance for the good of the whole country or the whole world. But definitely you want to make sure your laboratory testing is efficient and that you're able to be confident in your results. So that would I'm very selfishly focusing on our perspective.
Catherine, I want to add something on this question. You know, it's
go for it.
For us, we're in a sensitive spot where most of our projects are community driven. So whatever community members or people like we should be doing will probably go towards more that. So this Absolutely. Is particular about our current situation, is that this project wouldn't be what it is today if it was not actually a community driven project. We didn't ask for this project. Community members actually came to us and asked us because they heard somewhere else in other cities they were doing it. So this is where it's hard for us to tell you what we will do in the future. It's going to be really depending on what community members and upper management will ask us to do. And pretty much it's more a political answer when it comes to that. Back to you.
Great. Thanks, Laurence. And yeah, that's, I think, where having more options gives us more of a menu to choose from. If a chief or other decision maker comes to us and says, hey, I'd really like to test for X.
Thank you. I think we have time to take one last question. So this question talk about, during the presentation that you mentioned that there were some lab employees who were the former students from the community. Did they study lab work in the community or went to college somewhere else? Do you have like a recruitment training program that you're aware of?
So that's a great question. And Reggie, I'm going to get you to jump in and add to this because you've worked much more closely with the laboratory employees. So we were able to hire them through the Chia-Yu Lin Research Institute, where they'd already gotten some, I think, partly on the ground research training, and also had some training through, I believe they were doing some online courses through McGill University. I don't think they had necessarily did a lab technician training, keeping in mind that the gene expert is quite a simple instrument to be able to use and learn. We did have one of our laboratory employees who actually got recruited from the hospital lab and is now working with them. So a bit of a success story. Reggie, do you know more about the training that the guys from CIRI got before working in the lab?
CIRI provides different types of research approach on different projects, and they do have, and just recently they participated in the National Geographic documentary that was recently done in our region, and it was recently how do you say it, aired, and it will be available sometime in May, and that documentary gives a clear knowledge on what we have as environment or mammals, birds that roam the James Bay, and it is going to be good. And as for the training of these young men, we do have professors that come and they do online courses with McGill. That's how they're getting their training. And as you know, this week marks the 49th anniversary of the James Bay Northern Quebec Agreement, and within that, we do have components that we're able to govern ourselves in education and whatever training that we need. We abide by the Cree School Board or other organizations like the Health Board or the First Nations, and we are affiliated with different universities that really help our younger people become professionals, like Catherine being a doctor, and we do have several doctors, and it is quite important that we get our people educated more, and we really need them in the future because they are our future leaders.
Definitely, workforce development is very important and fundamental. Well, thank you, Catherine, Reggie, and Laurence for answering our questions. I'm going to pass it over to my co-moderator, Robert, for the closing remarks.
Hi, I will begin by thanking all of you for joining us for today's seminar of Surveillance Advances, and to our speakers, Dr. Catherine Dickson, Reggie Tomatuk, and Laurence Truong, for their fantastic presentations. A reminder that the recording for today's seminar and the presentation material will be accessible for viewing on NCCID's website in a few weeks. Please also take some time to complete our survey for this presentation. You can scan the QR code on this slide to access the survey, or look for a link in an email that will be shared shortly. In the post-seminar survey, you will also be able to request a letter of participation. There will be no seminar in December. We will resume the seminar series in January. So please join us for our next seminar on Tuesday, January 28th, 2025 from 1 to 2 p.m. Eastern Standard Time. If you have more questions about the Surveillance Advances seminar series, please visit our webpage at nccid.ca/Surveillance Advances Seminar Series for more information. We would also just like to plug the NCCID is currently collaborating with the Canadian Water Network on a wastewater-based surveillance program, and we've teamed up to help local public health practitioners and provincial health agencies effectively use wastewater-based surveillance. We will provide a link to our current program in an email or in the chat right after this webinar. So that concludes today's seminar. Thank you all for joining, and see you in the next year.